I do want to make a comment. I don't want to, Stan and I have not matched up, and he's on there. So please vote for him or not, whatever your conscience is. But there is a possibility. I just, again, it's my bad. I put it on there, but go ahead and vote. And if we need to make another selection, we can do that as time passes. So that was I pushed that out too soon. So thank you. That was an easy vote. Appreciate it. Thank you so much, Will, for doing that. Will and I kind of talked about this, and with it being the last club of the year, our final or holiday meeting, I have some fish sticks in front of me. So I'm having a holiday meal. Anyway, we didn't have our holiday banquet that we were hoping to have. Appreciate you all hanging with us and being here. But in light of that, we're going to break out into groups, and we're just going to talk about whatever the group wants to talk about, kind of like what you would do at a meal or around the table, just whatever's happening. So if you're having discipline issues with your children or your grandchildren, you can share all that stuff. So Will's going to separate us out here, and then we'll be back together. The pre-selected time runs out, and then we'll get Stan on the home. Let Stan do some conversating with us. Okay, welcome back, everyone. I see Chuck joined us, and so did Logan. Oh, and Jim Hicks. We got a whole crew that came on board since we've been there. Hey, Vern.
Chris, that's great. Jim has something to tell you before he jumps off again. So,
who does?
Jim Hicks has something to tell the group.
Okay, Jimmy.
I just wanted to share some not good news. For those of you who have been around for some time, you've known that probably Terry Goodman has had cancer, and I visited with him day before yesterday, and his days are getting pretty short with us. He said after last week, you told him he probably would be looking at 2 months at the best. And Terry's pretty weak. He would still, for those of you who were close enough to him who would want to, between 10 and 2 or 10 and 12 and 10 and 12 and 2 and 4. Times he's usually not sleeping. If you want to try to call him or drop him a card. But I just wanted to pass this on. His spirits are really quite good considering. And excuse me. And yeah, I mean, he's reconciling his situation well, and he's at home, and his wife and daughter live there. And at any rate, it's not good news, but I wanted to pass this on to. I know many of you knew Terry, so I didn't want to be downer into the meeting, but I wanted to share that with you.
We can't take those moments of concern as a downer. I mean, it's kind of part of life, and it's bad. And that's the extent of that. The encouragement, what we can do for somebody in that position is really important. And so I really do want to add to what Jim said, encourage everyone to reach out and embrace him in this. And nothing will make you feel better, even though it's sad, but you'll feel good about doing that. So thank you, Jim, for bringing that.
He was a long-term Rotary member. I don't know how many years, but decades, and a contributor for many years. Very good.
Great.
So,
well, thank you again. I do ask for health updates, so maybe I need to ask for any others. We kind of hit Larry and now Terry. Carol, is there anybody out there that we need to be thinking of before we break into our time with our discussion here?
I can just give you an update on Larry. As you know, he's home from the hospital, got home in time for Hanukkah, which was great. He said he no longer takes anything for granted. Waking up next to his wife and being able to give her a hug and go downstairs and watch the birds was magical. And unfortunately, when he was in ICU, he saw many people leave in body bags. It was very heart-wrenching. He's doing better. He did develop something on the back of his palate, and they're treating him for thrush right now. So he's unable to talk, but he can chat via chat or text. And who knew we'd all want a day when Larry couldn't talk? No. But we're grateful. He is getting stronger, and Ruth keeps us all apprised. So that's the update on Larry.
This is Wayne Bird. I got some news on the positive side. I just visited with my urologist at the KU Med, and he did what we call the tour de bladder. And the bladder looks great, no cancer, and everything is doing very, very well.
So you can say you're good to go.
In every meaning of the word.
Yeah. Well, that's great. Thank you for that, Wayne. We've all been praying for you on that, so that's a good thing. Okay, well, folks, with no other comments, Patrick, are you going to do a slight introduction? We're going to just let Wayne do it. Sorry, I was talking to Wayne. I'm looking at Wayne in the picture.
Yeah, I can do real quick. Not a real short one for Stan. Are we ready to go?
I think Stan's ready to go.
I am. You want me to just go ahead?
No, I got a quick one for you, Stan. I want to make sure. I didn't know if you were back. I know you said you were hopping off. It looks like you're back on. So, so obviously our speaker Stan today. So Stan Holm joined Olathe Health leadership team in November of 2018, serving as president and CEO. Olathe Health consists of 2 acute care hospitals, the Olathe Medical Center and Miami County Medical Center, has a medical staff of more than 325 physicians and of a roster of more than 2,500 associates, and more than 60 primary care, specialty care, and outpatient services located in 5 counties. He holds 24 years of progressive experience with acute healthcare facilities, serving as a leader who builds strategic partnerships. Major strengths include building trust, leading through difficult change, empowering leaders, and deliberate focus on patient, family, physician, and associate satisfaction, and developing service that transform care in a positive way. So welcome, Stan. Thanks for speaking to us today.
Greatly appreciate it. Thanks. And then Will, do you have slides that we can go through? And to all of you, I only have about 12 or 13 slides, so it's not about 40 or 50, and hopefully have some time for questions, but we'll just move to the second slide there for me, please. So I want to start with, seeing your doctor is safe. We had a huge campaign on this. All the metro area health systems and really around the nation health systems are talking about this at great length, because we are seeing more and more patients that are holding off their care. And obviously, when you look at the way the risk and benefit of that, the acuity of patients coming through our emergency department, we're now admitting probably 70 to 90 more patients each month in the last 2 or 3 months that are of higher acuity on things that our teams evaluate and look at, saying, gosh, if they would have just come in earlier, there could have been some better results and anticipation. You can see kind of a list on the bottom of that page on high blood pressure and diabetes and obviously asthma and arthritis or chest pain or cancer screenings. All of those are things that we're seeing patients that are holding off care. And there's this perception, and I will show you statistics of, we are seeing higher volume of patients that are COVID that enter our facility, but they're not acquiring it or obtaining it while they're here. And so I think the people that are putting off care are thinking, wow, I'm seeing all those COVID cases in hospitals and in health systems, so maybe I don't want to be around them. But we're finding that that has a drastic impact on the negative for patients who do need to be seen. So a lot of us are pushing out big campaigns of seeing your doctor is safe. Obviously, ignoring your health isn't. So just something we could talk on a little later too. Next, please, Will. And then just in the early days of the pandemic, just warming up again, we had a chamber that did a frontline fund. We're supporting our restaurants and generous donations to our healthcare workers, church groups and individuals with what they did and celebrating our teams. School district, when they let out last, really April, May, they had extra hand sanitizer. They also did food drives for us, innovative solutions where we can work together with area businesses, and then even groceries to go for our staff with our local Sodexo team on raising funds for them to be able to have food as meals as needed. then moving to the next slide, when we're also looking at pandemic today, fears continue, just as I was mentioning, both in our communities, also even our providers. When we look at providers of care, while they are protected, we've never had an issue, even when there was tight PPE, personal protective equipment, and what they needed. Never did we drop below a safe avenue for them. But as they're seeing this more and more in the system and the time goes on, very uniquely, there's just new concerns. A lot of our frontline teams have new questions and thoughts that we obviously work with our leadership teams to make sure that they get all the information to ensure that they get what they need. And patients, as I just mentioned, they're fewer are seeking the care for some big things they needed to come in for. Collaboration has been key from the very beginning, where with really the governor having a lot of us as CEOs on phone calls, talking to us in healthcare about what she can do for us. Secretary of Health, we have meetings with him every week on the phone with really kind of a round robin. What is everybody seeing at the different locations around the state, in different major metropolitan areas and rural areas, what that looks like. Our county officials interact with them at great length on an ongoing basis, and the other hospital systems and health systems on a every other week basis. And actually now it's more weekly again. The CEOs get together. Early on in the pandemic, we were very quickly recognizing our chief medical officers, our chief nursing officers, and our supply chain executives really needed to collaborate more closely. And so they are meeting weekly and continue to stay very close to one another. Surprisingly, I figured that was happening around the nation when health systems would partner around the pandemic as our focus. And we're finding that Kansas City metropolitan area is fairly unique and pretty special about just the depth and transparency that we have in our market is pretty special in a great way, to where we're all learning from each other. What's everybody seeing? What do those trends look like? When I show you our statistics in Olathe Health and Olathe Medical Center in particular, I can tell you that those numbers I'm going to show you in a minute are very comparable to what Shawnee Mission sees. And Sam Hundergart and I actually communicate on a regular basis, just like our chief nursing officers and our other leadership team members. And in incident command, our focus has been those 4 S's on space, staffing, supplies, and standard of care from the very beginning. Obviously, every decision we make is based on safety first. Staffing is a focus now, whereas back in March and April, it was PPE, as many of you know. But as we've developed, tertiary and quaternary related innovative ways to bring in PPE that's obviously approved by the regulatory bodies nationally, that's lifted back up. We have certain things that peak up, like we have these purple tops that we hand sanitize and do different sanitizing areas that was starting to get a little short a couple of weeks ago, and then we got our secondary suppliers to bring that in. But staffing has been really the biggest one that a lot of us, and you're hearing in the news, and I'll share with you some of the things we're seeing, but then also answer any questions you have. Testing, average turnaround times have doubled in the last month, whereas our average 7-day average of getting tests back were, within, 5, 10 hours, max 24 hours. Now we're seeing those in 10, 15, 30, and 40 hours to get tests back from the reference labs on what we're looking at. Statistically, just to give you an idea, and I'll go into more detail on subsequent slides, but our Olathe Health system, we've tested over 28,000 patients, and of those, about 4,800 of those have been positive. So about 17% of those that we test are positive. And if you look at Johnson County and the state of Kansas, we've had that same trend where we're, a little higher than Johnson County and always lower than the state. And so as those used to be in the 5%, 8%, 10%, 12%, we were always a little higher than Johnson County and always lower than the state. And all those numbers have been trending up to where Johnson County has been increasing and the state of Kansas has been increasing. But I just want to put a reference that of those 4,800 positives, 3,300 of those are treat and release patients in our clinics in the 5 different counties that we serve patients. So just wanted to put that in perspective. Then moving to the next slide. Now getting into some of the statistics, the average active COVID positive patients that we've had, and this is in our census, so a snapshot at midnight every night, how many patients we have in house and how many of those have been COVID positive. You can see by month the averages, where it was under 10 patients for the whole month back in March, and it started declining as the warm weather came. A lot of us were thinking by really April and May that, okay, and even June when it got to its lowest number per month, we're like, okay, a lot of viruses during the summertime slow down or get killed off, and that's really not a big deal. And then we saw that resurgence starting to happen again in July and August and September, but still very manageable, still under 10 of our patients in-house at any given time were COVID positive. And our overall census numbers, usually about 150 to 220 patients per month average that we're looking at, or excuse me, per day. Let's see what happened in October, November, and December. So when you saw the number of patients that are COVID positive now inclining and reaching numbers, closer to an average of 40. At one time we had about 62 in-house, but the averages just kept increasing. And then you might say, okay, well, what about your critical care? How sick are these patients? So if you'll go to the next slide. So that's overall patients. And then our average critical care unit COVID positive patients, and this was an average per day, you can see where that number very similarly back in March and April stayed pretty steady. The summer month in June and July, we were thinking, okay, it got weaker, may have actually changed its molecular structure. That sounds good. And then July and August, September, started seeing an incline. October, it dropped. We're like, okay. And then you see just our acuity of patients, October, November, and December in our CCU, or our critical care unit, just continue to climb as that really doubled and sometimes tripled. When you're thinking the 2 or 3 to now 9 and 10, you're seeing some of those numbers tripling. You saw that on the other page too, doubling and tripling. And then to the next slide for me. So inpatient or observation, we kind of just use both of those interchangeably, because you can be admitted under a full inpatient admission, or you can be admitted to a bed in an observation status. But these are patients that discharged as expired. So back to the criticality of patients, and then how many of those are actually dying due to COVID. Look at those first several months to where we really didn't see that. A little blip in April, really nothing May, June, July, very, very low August, and then September, and then October, and then November. November was really one of our highest volume months. It also had the highest acuity. It also had deaths associated with it. The red line is just the cumulative number. So you can just see, stacking those bar graphs is where that comes together for the overall trend. Then the next slide. Then looking at our associates, our staff within the health system, you can see that very low acuity of patients, or excuse me, our staff that had COVID positive results. And then it started to slowly increase over the summer. And then you can see even our own staff, because of what was happening in the community, really had an increase in November as well. And again, the red number is just the cumulative effect of that. They really were not getting COVID inside the health system at work when we looked at it. If they were, we'd see cohorts of staff members that got it in clusters by unit. Never saw that. There were occasions where their friends outside of work, and when they would get together as friends, back in our breakout session, it was, hey, what are we going to do for Christmas? And can we have close family members or friends that we trust get together? And what we're trying to say to our teams are, the COVID virus doesn't know who you trust or not. So when you're around others, the ability for that to, get exposure to and attract that virus has increased for our staff. But, being essential workers, their time frames being out has impacted the staffing of our facilities, because when you have individuals that are out, where we've seen 30, 40, and 50 of our associates out of our 2,500, but when last year or the years before, when you had a vaccine for the flu, fewer of our associates would be out for the flu because they took the vaccine. In addition to that, when they were out, they're out 2 to 3 days, and then fever-free, you come back. Well, with COVID, once you're out, you're actually out for that 10 and 14-day window. And then you stack that on top of individuals any given day that might have it. If you've seen in the news and other healthcare systems talking about the impact that's had on our staffing, that's what that relates to, is just that they're out so much further for COVID. And then on top of that, how many of them are going out is what it looks like. We have a couple of weeks where it would peak and get really high, and then it would stabilize. Vaccine update, just quickly giving you that update, was requested. Healthcare workers and long-term care facility residents are in the first priority group. Essential infrastructure workers are next, followed by the elderly and individuals at risk. We actually will find out later this week. We're thinking by Wednesday when we will receive the vaccine. We did sign up for it. There's obviously long lists that you have to do with the government of, can you do these things? What's it going to look like? Can you protect the the integrity of the vaccines and how you distribute it. Move to the next slide, Will. And I've got 2 or 3 slides on the vaccine, and then we'll open up for questions. Individuals should expect the side effects such as muscle aches, headaches, and chills and fever. Very similar when you get a flu vaccine. They usually every year tell you you might have these side effects for it. They're transient, meaning that it's usually less than 24 hours. And it is impossible to contract COVID from the vaccine. Serious side effects were not found when they did it. While the speed of development was unprecedented, a lot of people ask, gosh, did it come out too fast? What's it look like? The science leading to the approval is sound and the corners were not cut. What that means is a lot of their phase 1, phase 2, and phase 3 trials, normally they do those sequentially. They did them in parallel. Pfizer vaccine is authorized for individuals over 16. The efficacy was uniform across ages and ethnicities. It has not been studied in pregnancy. So people have asked, well, if I'm pregnant, should I take the vaccine or not? While there's no reason to expect it would not be safe, there are providers that are saying, let's let pregnancy be one that we hold off for a little bit. It goes both ways on that one. That's a little gray. The next slide on vaccine update. In the phase 3 study, the vaccines were 95% effective in preventing COVID illness. Normally in a year where we do the flu vaccines, if it's over 50, 60% effective, we consider that a success. So some might say, well, is that a real number? What's it look like? When I've been asked that question, I said, you know what, even if it has a 10% error rate to it and it's only 85% effective, that's still way better than what we get in our normal flu vaccines. About 20,000 individuals are in the vaccine arm in both Pfizer and Moderna phase 3. A 2-dose series is required. So if you asked, if I get this, I heard we might have to go back and get a second shot. You do to 21 days apart for Pfizer, 28 for Moderna. Pfizer requires a negative 70 degrees Celsius storage, and it has to be used within 5 days. Obviously, everybody that has that is putting plans and structures in place for it. We do have the ultra cold storage ability. The organizations that clicked yes for the government that we could be a site, actually many of us had to go purchase that type of cold storage to handle those things. Those aren't cheap storages, by the way, but we recognize to be a center for the good of our communities, it was important to do that. Next slide. So almost finishing here, innovation, that makes us better. Telehealth has accelerated. We did that from really March and April, and it continues to advance. We have Spot Saver now within Olathe Health. A lot of health systems have the ability to wait online, so you don't have to be in waiting rooms. Air slicing procedures, there's new processes put in place early. Those continue to be successful for us. Open and available for care, safety first. There are dangers in delaying your care. That's a big theme you're hearing from all the health systems. Do not delay your care, because what they're saying is, you're giving up one critical thing for a COVID patient, but if you're coming in for non-COVID reasons that could have been prevented, there's detrimental effects on that. And then continuous monitoring, we're going to have guidance that is still evolving, and every decision we make will be data driven on how we proceed. I think that's it, and open for questions.
Hey, Stan, it's Patrick. 2 quick questions about the shot. Will it be an annual thing like the flu shot? And do you expect, or has it shown, will you potentially get the side effects with the second shot as well as the first one?
So first, they're saying that this may last 2 to 3 years. So when you get it, it may last 2 to 3 years. Simultaneously, though, they're also saying that future flu season shots, they're going to try to combine COVID vaccination so that you get one shot for both. That's not evolved enough yet, but I think the vision is that you can start getting a combo shot in the future. And whether the second shot still has the symptoms, my understanding is it's less than the initial one, because you've already built up in your RNA and the spikes for your proteins have already created it in that first wave. So it's less likely you'll have those symptoms on the second one. But there possibly could be that.
Hey, Stan, a quick question. You said 21 days for the Pfizer second shot. So is that on the 21st day? I mean, do you have a window there? Do you need to get that taken? What? Because some people could be traveling. Who knows?
That's a great question. My understanding is there is some flexibility around that date. I don't know the detail of it's plus or minus 1 or 2 days. I've heard that. I can get that back to you though and get some confirmation of it.
Just curious.
Yeah.
Hey, Stan, this is Jim Courtney.
Yes.
Thank you for your presentation. Really appreciate that.
You bet.
positivity rate, that 17% you showed, how can that be extracted to the general population of Olathe? Or how do you?
When we look at underneath that slide, I mentioned what the Johnson County is, and it's actually lower than Johnson County, or excuse me, it's higher than Johnson County, but lower than the state. For Olathe, the numbers we have aren't particular to the cities that we have on the reliability. It's our own internal data compared to the county and the state. But I know part of it, and even the city, when we talk to the city officials, as you know, many of you have that connection with both our cities and our county. I think we fall back to where's the reliable data that we can all trust. And what we're looking at is the comparable to the county, more so than the individual cities within the county. But you could assume that when you look at our primary service area and the high percentage of patients we get in Olathe, then Overland Park, Lenexa, and then down south, relatively speaking, a higher percentage of that is in Olathe that we're still seeing. So if the county numbers, if we're higher than the county numbers, you could deduce that in Olathe it might be a little higher, but I can't confirm that yet.
Dan, this is Mike Tracy. Hi. So I'm kind of curious, when Moderna comes out, are we, the consumer, going to have a choice on what vaccination we want? How is the healthcare community and the consumer going to decide which one they want? Or which one will be offered? Or does it matter? It's interesting. They're not really the same thing, are they?
No, and I think what we're finding is there's such an intensity to just get the first one rolled out. We know the second one will be coming. Our understanding will be that if we've decided to store and house the first one, that even though we don't need the negative 70 degrees for the second one, we do anticipate the same processes and availability to the patients that we serve. And right now, we've just really been focusing on availability. For example, while there might be over 25,000 vials pushed out through the state of Kansas, we may only get the first dosage packet, which might have 975 in that first packet. So if we only get one of those, you can imagine our frontline teams, there's going to be a staggering of that. Second to that, we have trying to get our other associates tied into that and our providers as well, clearly. And then when you look at what you have available to the community, I think because of supply and demand, even though we're saying, okay, you might have 25,000 in round one, followed by a couple of weeks later, 100,000, then you have the other vendor coming in. I think our approach has been, we're probably just going to have the inventory of both. The processes are going to be similar, except how you store it at the higher or the lower temperatures. If a patient prefers one or the other, we will likely have that flexibility. But we haven't gotten to that detail of trying to separate it from choice of patient. It's more of first come, first serve, and what we have is supply and demand. But the likelihood is if you ask for it, we should be able to give you one or the other, depending on supply when it comes in, when it gets to that next phase. The amazing thing is that gives you an example. Even though we might this week know what we're getting, hopefully by Wednesday, we're already anticipating that even getting through all of our associates might be multiple weeks, if not 1 or 2 months, just because of supply and demand and what that looks like. Now, if it happens faster and everything comes in better for us, and then you talk about the LTACs, then you talk about the elderly and high at risk patients. When you think of flu being more of a preventive, there's such a pyramid in the hierarchy of those that the federal government has told us this is in your 1A group and this is in your 1B group. The state has also said you have to distribute it this way, first, second, and third. Then we get out to the public. So we'll probably have a little, runway before we get it to the public, which will have more information later.
Stan, Nate Harbor here. First of all, congratulations to you and Liz. I understand the virtual gala did very well. And
it did. And a side note on that real quick is that when you look at a lot of these annual events, and I think Will just mentioned it too, with organizations that get together virtually, without the overhead, a lot of organizations are seeing record individuals donating. Without the overhead, they're actually having record results. And we did the same with our gala this year too. So thank you for recognizing those that participated. Thank you too.
And I wanted to thank you for this really timely, awesome information for all of us. And I heard a report this morning that the distribution was going to start by going to Walgreens and CVS, and I didn't quite understand that. I would have thought it would have been distributed to hospitals like Olathe Medical Center. Is that, does that ring any bells, or is that making any sense to you?
You know, it's the timing of each of those, because I've heard the same, and I'm thinking, well, if the federal government has already ranked healthcare workers and long-term acute care facilities second, followed by those that are high risk individuals, I can only imagine that those locations that have volunteered to be a distribution site for those vaccines are preparing for the third group of people, which would be the community members that say, look, I feel like I'm high risk, I'm a diabetic, my doctor has said I need it. And then as they get their distribution, they will have it available. But we do know that the first district, like all 23,000 or 25,000 that's come to the state, I'd be surprised if Walgreens and CVS get that first. But as they're preparing for the third wave, it'll be like normal flu vaccinations that are readily accessible across different locations, except for the fact that, you know, to have the Pfizer one, you need a negative 70 degrees freezer to hold it and store it. And then you have to, once pulled out, utilize them within 5 days. So you think of all the Walgreens and all the CVS locations at every corner that you can think of, they're not going to have, I don't speak on behalf of them, but just logically, there's no way they're going to have that many freezers available or distributions within 5 days that I can think of. Now, if they have a centralized location and they can push it out, they're very creative, but I think they're going to probably be in that third wave, and they're just preparing for it.
Thank you.
That Stan's thought process, nothing official or part of any official stance by the government or elected officials.
Oh, so I shouldn't be posting that. I'm sorry.
Yeah.
So Stan, Jeff Ellis, has Olathe Health had any impact from referrals from more rural areas that can't handle the intensity of some of the cases?
We have, and while you've heard some of those stories, they're legitimate. They have plateaued a little bit for us. So I don't want you all, even though you saw my trending line continually going up, I also hope you saw the bar part of December where it kind of dropped a little bit. But November, we actually had an individual that came from, as an example, came from Western Kansas. Their normal top 2, top 3 referral locations they tried to send them to denied them access. They were overwhelmed with cases. So by fixed wing, that patient arrived in a very high acuity situation to Olathe Health, for which we cared for them. So we have examples of that. We also hear from some of our other CEOs that Oklahoma, Missouri, and Arkansas even have notified and called on them saying, we're backed up in our systems. We can't take any more. Our normal referrals into higher acuity locations are not accepting anymore. Can you accept patients? And so that is a real legitimate thing that has occurred. But November was really heavier than what we've seen in December. And again, that's Olathe Health. There are sprinkles and stories inside Metro KC area. Obviously, being KU, for example, they are such a regional referral center anyway. Their numbers are exponential to the rest of us in the Metro KC area. So they probably have a more frequent stories of that. But all of us have been impacted. When I talked to Sam at Advent, he's seen it too.
Well, thank you. I'm going to have to call a question. We're about out of time here. So those of you who have any other questions, feel free to reach out to Stan. I'm just offering that up for you, Stan.
No, please. And for all of you, if you're okay with it, I'll just give you my cell number real quick. Feel free to call me or text me with anything. My cell number is 772-321-1900. That's going to come up Vero Beach. I've had it for 15 years probably. But feel free to text me or reach out if you personally have anybody that you want to ask questions about or anything you want to know that I can get some of our experts' opinion on things too.
That's great. Appreciate it, Stan, so much. Everybody applaud. Thank you, Stan, for giving your time for this and prepping. Will, do you have any answers for today's vote, survey, whatever we want to call it? Thumbs up means thumbs up. guess if you voted no for somebody, it's a thumbs up. I don't know. So anyway, we'll push that on out. And I think we're going to do we'll conclude with the 4-way test. Will, unless you had any comments to make. Okay. 4-way test of the things we think, say, or do. Is it the truth?
Is it fair to all concerned? Will it
build
build
goodwill and better
better
friendships?
friendships?
Will it be
Will it
beneficial?
be beneficial to all concerned?
So folks, this is it for the year. I'm going to miss everyone. We'll get back together the second Monday of January. Look forward to that. Until then, you all be safe. Have a great holiday season, okay? Again, I'm going to miss all of you. Thank you so much. Take care.
Yes, you do. Bye-bye.